Today we'll discuss on a very prevalent, with a very high incidence, vitamin D deficiency. Vitamin D deficiency across all the lifespans, it's a public health issue now. Vitamin D, we all know, is a multifaceted pro-hormone. We all know it is basically for the bone health, essential for calcium homeostasis and bone metabolism. It prevents diseases like rickets and osteoporosis. But now we also know it is involved in the neurodevelopment, implicated in the dopamine neuron differentiation, and is a high risk factor for schizophrenia, Alzheimer's disease. Also cardiovascular disease. It's a risk factor for cardiovascular disease. And also it plays an important physiological role in mediating the immune response. So it is supposed to be involved in the high risk incidence of cancer that we see nowadays. Vitamin D deficiency is seen across all ages, from infants to adults. In India, we have more than about 90% of infants who are vitamin D deficient. Similarly, adults, about 80% are vitamin D deficient. And in elderly, the incidence is around 96%, which is a very high incidence. So we need to tackle this menace properly. Vitamin D deficiency in India is a public health crisis. We need to address vitamin D deficiency to improve the overall public health in the country. Now coming first to the infants. In infants, which are exclusively breastfed, the incidence is around 0.6 to 91.1%, which is quite high. And maternity, pregnancy, insufficient levels during pregnancy, which directly involves lowers the vitamin D levels in the neonates. The limited UV exposure due to cultural practices and lack of supplementation during lactation. According to a study, the vitamin D levels of the infants who were born to mothers who took vitamin D during pregnancy was much higher compared to the mothers who did not take. So we should be supplementing all our pregnant females with vitamin D during the second and the third trimester. Exclusively breastfed infants show a very low level at 6 months compared to infants whose mothers were given vitamin D during 24-48 hours postpartum. This increased the serum vitamin D levels in the breastfed infants. So vitamin D supplementation during postpartum lactation is also very important. So how to prevent the vitamin D deficiency in infants? First of all, supplementation. The infants can be supplemented with vitamin D in the first month of life and continued throughout infancy as recommended all over the world. Maternal supplementation. There is high evidence that high dose maternal supplementation during pregnancy and lactation helps mitigate neonatal deficiency, and then early diagnosis of problems due to vitamin D deficiency have to be picked up and treated accordingly. Now coming to the role of vitamin D in children and adolescents. Adolescents are equally affected with vitamin D deficiency, and the range is around 14% to 24% from ages 1 to 20 years. Vitamin D is essential for children. It maintains bone health, we all know, and immune-mediated pathways. It's also involved in autoimmune disorders, asthma, atopic dermatitis. So we should be ensuring that children also have adequate levels of vitamin D in their body. Vitamin D, it has an immunomodulatory effect. It is synthesized through sunlight and it is a vital hormone for immune regulation in children. It supports bone and dental health and modulates immunity via receptors on immune cells, influencing cell function and differentiation. Vitamin D in atopic dermatitis is a chronic skin condition seen in around 20% of children, and it's directly linked to vitamin D deficiency in children. So maintaining role of how does vitamin D help? It maintains skills lipid barrier hydration. So a deficiency may increase the atopic dermatitis risk in children. High dose of vitamin D, 50,000 IU per weekly, is supposed to enhance the cognitive function in adolescent girls, improves their memory, attention and decision-making skills, and also in girls and boys alike, its vitamin D supplementation improves lipid profiles and reduces inflammatory markers. IAP, Indian Association of Pediatrics, recommends Routine vitamin D supplementation at doses of 400 IU per day in infants, and it's safe to be given in preterm babies also. While in childhood and adolescence, regular supplementation by the association is not recommended. The estimated average vitamin D requirement in adolescents is around 400 to 16 IU per day, which should be met by sunlight and dietary sources. That is what they say. Now, exploring the impact of vitamin D in PCOS, which we see so frequently in our practice. Vitamin D deficiency, it leads to calcium dysregulation, it blocks the follicular development and leads to anovulatory infertility, menstrual irregularity. And it also causes a decrease in the SHBG sex hormone binding globulin, increases the testosterone, leading to hyperandrogenism, hirsutism, and all those features of PCOS, again leading to insulin resistance, chronic inflammation, decreased insulin resistance. So it's a vicious circle. The vitamin D deficiency has to be corrected if we need to control the incidence of PCOS in our country. High prevalence of vitamin D is seen in the PCOS women up to 70.3%, which is a quite high incidence. It has a protective effect on the systolic blood pressure of the females with PCOS. A beneficial effect on the ovulatory dysfunction and insulin resistance is seen. It affects by decreasing the serum fasting insulin levels and fasting blood sugar. So all PCOS women should be supplemented with vitamin D. And there's one study which shows in which two groups were there. Metformin was given to one group and other group was supplemented with metformin and vitamin D. The group B, which was given metformin and vitamin D, showed a better reduction in fasting and postprandial glucose levels than group A. They had a better lipid profile and better response was seen in improving the polycystic morphology on sonography. So a supplementation of 60 international units vitamin D weekly may improve PCOS and prevent further consequences. Now coming to pregnancy and lactation. During pregnancy and lactation, we all need the mothers need vitamin D. First of all, because the mother provides a large amount of calcium to the fetus, so the mother has to be supplemented for herself and for the growing fetus. The deficiency of vitamin D can occur in young women, include some calcium loss during pregnancy, which increases with advancing pregnancy. So all mothers should be supplemented from the second trimester onwards. Vitamin D deficiency is associated with both maternal and neonatal complications. There is increased risk of impaired fetal neurocognitive development, increased risk of high blood pressure in the offspring, reduced bone density in the children born to these mothers, increased risk of schizophrenia and Alzheimer's disease, asthma and rickets. These children are born small for gestational age. The mother has high incidence of bacterial vaginosis, low birth weight infants, increased incidence of preeclampsia, gestational diabetes mellitus. So maternal vitamin D deficiency can negatively impact both the course of pregnancy and health of the fetus and the newborn. Then in a study when vitamin D supplementation was given, we saw 50% reduction in preterm deliveries, 25% reduction in infections of the mother, and 30% reduction in the comorbidities like diabetes, hypertension and preeclampsia. So vitamin D supplementation is very well safe and required for all the mothers. Vitamin D supplementation during the pregnancy, it showed an improved cord blood vitamin D levels and it prevented vitamin D deficiency in the infant. So pregnancy supplementation is very important. These are the various recommended doses, average requirements of all the pregnancy, lactation and other females. Now coming to the postmenopausal women. In postmenopausal women, vitamin D plays an important role in improving the urological health. It reduces the risk of urinary tract infections by enhancing the immune response and strengthening the urothelial barrier. It improves the vaginal health. It decreases vaginal pH and dryness and maintains vaginal epithelium. It enhances sexual function and the pelvic floor functions are also improved. It decreases the risk of onset of overactive bladder and urinary incontinence by maintaining the efficacy of muscle functions. It is involved in the various metabolic pathways in all the postmenopausal women and most important is the bone and the muscle health. Sarcopenia and osteoporosis is reduced when we give vitamin D supplementation to all these postmenopausal women. Now, the supplementation required for the postmenopausal women, according to the Indian Menopause Society, the therapeutic doses of vitamin D is 60,000 IU taken once a week for 8 weeks, and then for the maintenance therapy, they say a dose of 60,000 IU taken once a month in summer and twice a month in winter is required. Now, vitamin D deficiency is required, is important in both males and females in the elderly. There's a 13% reduction in vitamin D production per decade, demonstrating output at 70 years to be half of what that was at 20 years, which is very important. And it is basically supposed to be due to the aged skin. The skin absorbs and produces less of vitamin D as it ages. So vitamin D supplementation in the elderly is very important. Vitamin D deficient older adults have increased risk of reduced bone mineral density, increased risk of fractures, osteomalacia, increased risk of cardiovascular events, diabetes. There's increased parathormone levels, increased risk of cancer and respiratory tract infections. Recommended dietary allowances for vitamin D is almost the same for all ages according to ICMR. Now we have this new technology, Aggarwal technology in vitamin D, which is coming up. This technology allows for better absorption of vitamin D. It's because it is a very small micellar size particle and they remain protected from the digestion process, so the bioavailability is enhanced. To summarize, vitamin D is crucial for all stages of life, from antenatal to infants, adolescents, pregnant women, and the elderly and postmenopausal women. We should be supporting and taking care of the vitamin D level of all the patients and ourselves also. Thank you.